Hello everyone. This is the second case in the postnatal module. This is the second case which I am going to discuss today. And as I already have given you the introduction about the postnatal period, what all things you should ask and what things you should keep in your mind. Now with that, I already have given that introduction. Now this case, I am going to straight away start with this case. So now you have seen this case and you know what it is. So now I am going to start like this. Hello. I'm Dr. Manjula, one of the doctors of the accident emergency. May I confirm your name and age, please? Because here has come to consult you. She is not admitted. So how may I, so she will say, I'm. How may I? She will say, I'm Mrs. Jasmine Jacob, doctor. And how may I address you? You can call me Jasmine, doctor. And so I can see that you're having headache and you're looking quite sick. And this is the agenda now. So I'm sorry to see you in such a condition. Have you come alone? I see that you have come alone. Is there or anybody is there to who accompanied you? And so she will say yes or no. Would you like to have somebody with you because she came with severe? She's looking sick also. That's why. Now, have you taken any pain relief medication? She will say yes, doctor. They have given when I came. They have given the relief medication. Otherwise, if she says no, then you say okay. I will arrange. Can I arrange a relief medication for you? She'll say yes. Then you say, do you have any allergies? Then just wait a few seconds, 1 second, and then you say, are you comfortable to talk now? At this stage, yes, doctor. Now, can you tell? So this way, either she has taken medication or not. You have to find out. And if she has not taken, ask her whether she requires. Now, can you tell me more about your headache? Open question. So you need to know because she came with a headache. That is a very important thing in the postnatal period. So you have to ask about the headache. So can you tell me more about your headache? When did it start? Where is the headache? And what makes it worse or better? Can you tell me what makes it worse? Sometimes standing or sometimes lying down, they will say. And sometimes it is one-sided, that is like migraine. And so that is why where it is, when did it start, where it is, and whether what is increasing, aggravating and relieving factors. Do you have any blurring of vision? Any problem with the vision? And so like you see double images. Then any problem in speaking? Did you know, do you have any fever or any sickness, any vomiting, any pain in the neck movement? So then, do you find any weakness in the limbs? Are you able to walk properly? Do you find any weakness in the limbs? Did your family members say that you fell unconscious or thrown a fit? Because she may not be knowing, that's why. So, and do you have any pain in the leg or pain in the chest? Any shortness of breath? And these are the related things which you want to ask about the headache because you want to rule out, you have something in your mind. So you want to rule out already different diagnoses in your mind. So related to targeted history you take. Now these are the symptoms you are asking, history of present illness. One more thing you should ask, have you had any similar headache before? That means in that case, it may not be related to the pregnancy. That is why. So this is about the history of present illness. Now, you need to know what is her delivery details. You just ask her about, I see now that she is postnatal. I could see that you had vaginal birth from the notes. I could see that you have vaginal birth 3 days back. How is your baby? Congratulations. How is your baby? And are you breastfeeding the baby? This is about the baby. And do you have any unusual bleeding? And either increased bleeding like that? Or any pain in the tummy? Do you have any pain in the tummy? Or do you see any faults when in discharge? How about your waterworks? Do you have any problem with the water while passing urine? But whether bowel opened up? So these are the common postnatal questions you need to ask. So then when she was discharged and went home and came back. So you ask her how was her condition at the discharge? How were you at the time of when you got discharged? How were you? And can you tell me whether you had faced any issues in your pregnancy? Like increase in the blood pressure or increase in the sugar or any clot? Have you been given any injections? Under the skin, like they say, blood thinners. Huh? So just you want to rule out antenatal this thing, venous thromboembolism. Now, have they given any pain relief in the back? So you want to rule out epidural also. So can I see your notes? So this way you have to take a targeted history. Now this is about the present pregnancy. And is it your first pregnancy? So then, if she says yes, then that's all. If you have previous pregnancies, then you say, ask about the previous pregnancies. How were the deliveries? And whether she had similar problem in the previous pregnancy, and after delivery, how is the, what type of delivery, term, preterm, and then whether it was a normal delivery or cesarean section, how were the babies at the time of birth, and how was our recovery. Now, coming to the medical history. So, are you on any medication? Anytime you had any migraine, because migraine can come and go. Any fits? Have you ever had any fits? You are wrong to rule out epilepsy. And any allergies? Do you have any allergies? So okay, no need of any blood group and all here. Now coming to the family history. Any family history of any concern like increase in the blood pressure or any sugars or clots in the family? Anybody has any history of any fits? So now coming to the social history, and sometimes they quit smoking, sometimes they continue with the smoking. You can just ask one word: do you smoke? And however, a BMI, see that I can see that your BMI is 34, and it's slightly higher. It is on the higher side. So now, Jasmine, so how you, then in that case you say, have you ever tried to? I see that it's on the higher side. I mean, if you have you are you following any diet and exercise program? Have you been connected to them? No, doctor, means usually they'll be connected because she's BMI high during pregnancy. They will usually connect to the diet exercise program. You just ask her. If she says no, then address then and there only, because you may forget also later on. Then you say, if you permit, I will connect you to the diet and exercise program. So to help you reduce the weight, because obesity is the risk factor for venous thromboembolism. Now, how is the support at home? Because she delivered, she needs more support at home. So then, how are you coping up with this new situation now that you have delivered? How are you coping up with your new situation? Yes, just check her mental status. Now, see, then you say, Jasmine, have I mean, your observation findings are here, and then it shows. I can see the observations here attached. I see that your blood pressure is slightly on the higher side. It is slightly more than the normal. So then anyways, blood test also are attached here, which I am going to discuss with you. So now, if you permit me, in the presence of chaperone, can I examine your tummy? And so down below, because if you want to say postnatally whether how is her uterus contracted well, or I mean is involuting nicely, and any abnormal bleeding, so then or any discharge. So this is what you need to know, and always say chaperone and verbal consent. These are the patient safety points. Now come, and Jasmine, would you like to add anything? Then she says yes or no. That's what. So now, Jasmine, let me explain to you your condition from your observations. You can discuss the observations here. Your observations show that your blood pressure is on the higher side. It's higher than normal, and urine then pulse rate also slightly faster, and then temperature is normal. Then urine report shows that protein is slight is seen, a minimal protein is there, and the ketone bodies are there. So they are on the ketone bodies are 3 plus. So this indicates, these ketone bodies indicate that you are losing water from the body. That is dehydration. It's called dehydration. That is loss of water from the body. And the other thing which I can see is the hemoglobin, that is blood strength, is also on the lower side. So, doctor, then why the blood pressure is very high, and what are you going to do with my blood pressure? Will I be all right? So I'm going to explain to you now, because we are with these findings from your history and from your blood reports and urine report, which are enclosed here. I can see that of two possibilities. I can think of two possibilities in your case. One is blood pressure is high, the protein loss is there, protein in the urine is, we can see the protein in the urine, and also you have ketone bodies also, that shows dehydration. So it could be that you're developing a condition called preeclampsia. So usually it develops within 48 hours, but sometimes it can develop anytime up to 6 weeks. It can develop within 6 weeks of postnatal period also. So that one condition is, I'm thinking, that is one possibility. The other possibility could be the clot formation. We are suspecting a clot formation in the vessels of the brain. Vessels of the brain, that is called cerebral venous sinus thrombosis in medical terms. So, can I take you forwards from here? Can I explain to you what is how does it develop and what happens and how we manage? Yes, doctor. So now already you have explained to her about the BMI. So here you can say, see, in these both conditions, we consider that it is an emergency. Right? Both the conditions, it is an emergency. So we offer you admission in the high dependency unit. So if you permit, so I'll tell you how we are going to manage. Now I'll inform my consultant. Your care will be under the team of doctors. That's called multidisciplinary team. So our consultant, then the now doctor will, our consultant will be, the team of doctors will be our consultant, the now doctor, then we will, your imaging doctor and eye doctor, and nurse also, senior nurse. So the nerve doctor, we will inform him. He will come and examine you, and he will examine for any neurological signs, that is any muscle weakness, any reflexes, and how you walk. So then eye doctor also will inform him. He'll come and check your eyes, and then my consultant also will come and speak to you. He will examine and speak to you. Now, what we are going to do, we will take a sample of blood after admitting you. We will take a sample of blood. For some blood tests, we need to do some blood tests to check the blood strength is already checked, but other parameters we need to see. Liver tests, we will do the liver test, we will do the kidney test, and also your blood sugar. Then second thing is, we will observe you. We will continuously monitor you. We will check your blood pressure, pulse rate, respiration, and oxygen saturation also. Continuously we'll be monitoring you. Then we'll put a catheter, small plastic cannula into your arm, and we'll give you IV fluids. Because I told you, you were losing water. That's the dehydration. So we need to correct that dehydration. Am I clear so far? Yes, doctor. Then, because you have pain, we will give you headache. We will give you paracetamol, and we'll continue giving paracetamol. And then we will also, because the blood pressure is on the higher side, we'll give medication for the blood pressure. That is one thing. And second thing, because you're having blood pressure and headache also, we will give one medication called magnesium sulfate to prevent developing fits. That's called eclampsia. So then what we will do, because your height weight ratio is on the higher side, we will think about giving blood thinners. Then to prevent clot formation, further clot formation. So and also second thing is, we will start, because we are suspecting clot in the vessels of the brain. So that we want to prevent it from developing, and also we want to dissolve it. So we will give you blood thinners to prevent further clotting. So we will start with small doses, and then small doses will start, and then see how you are responding. So then once, Jasmine, am I clear so far? So now we'll see the response, and if you're improving, then it's fine. But if there is no, we'll continue. But if there is no improvement, so then in that case, what we need to do, we will have to do a special imaging for you. That is called MRV. And then so that is where a chemical is injected, and then an image is taken. At that time, we will advise you not to do breastfeeding, and it will be stopped for 1 or 2 days. So then that will be advised by our nerve doctor. He will see, then he will advise you to go for the test if there is no improvement. And then once the report comes, and he will see, and if the clot is confirmed, the clot in the brain is confirmed, then he will give you blood thinners, but he will continue giving blood thinners, that is in higher doses. Then that is called heparin. So this is given as an injection form, and it is a treatment dose. It is given as a treatment dose. So now this will need to be given for few days, and later on we will switch over to the tablet form. But you need to take for 3 to 6 months. Okay, then Jasmine, then this injection will be decided by the blood doctor. So then coming to the, then you need to wear, apart from this, you need to wear stockings, and you need to keep yourself well hydrated. That is, take plenty of fluids, and you need to move around. That's called mobility. So then, but with the heparin, sometimes what happens, there can be some side effects also. Like sometimes there can be bleeding under the skin, or there can be allergy, itching, allergy, and then sometimes it can affect the blood cells also, that is platelets. So in that case, we'll give you some other substitute. But so then you need to stay in the hospital till you become better. And whatever medication we advise, let me tell you, they're safe in breastfeeding. This heparin injection is safe in breastfeeding. Even the oral tablet, which you are going to convert also, give you in future also, it is safe in breastfeeding. So then, when you're getting admitted, we will see that your baby will be with you, and so you'll be admitted in the mother and baby unit. So baby will be with you, and you can continue breastfeeding, and take care of your baby too. Am I clear? So then any other concern, Jasmine? Do you have any other concern? Now, as this complication has happened that require hospital admission, I will raise an incident report to know why it has happened and what could have been done to prevent it. And once the report is ready, this is instant report, and once it is ready, our consultant will discuss with you about it. So now, this way will admit you and take you forwards. I will document whatever we have discussed. This is the written information leaflet about this condition, and so you can see it and then go through it. And if you're willing, I'll make arrangements for the admission. So then I can talk to your family members also, and if you can give the contact number, you can discuss. Then you can also discuss with them. So now the whatever at the time of discharge, we will let me tell you, at the time of discharge we will give you some advice, that is, in future when you're planning pregnancy in future and pregnancies, then you have to take these blood thinners during pregnancy. You need to tell your GP whenever you conceive, and then you need to they will put you on the heparin injection, and that is during pregnancy, and then after delivery, and they will switch on to the oral tablet. And anytime in case you come across you have to undergo surgery also, you need to take these blood thinners. So you need to inform your hematologist, then they will start these medicines. The third thing is, if you plan any if you want to use some pills, oral pills for contraception, if you want to do some birth spacing methods, but we will advise you not to go for oral pills, hormone pills, that is containing estrogens. Hormone pills we don't advise you to take. So this way you have to take care of your future pregnancies. And am I clear so far? So now, so do you have any other concern? Okay. No, thank you for talking to me. So